All right, we'll get started. Thank you all for joining us today. Welcome to today's webinar called Phase 2 Childcare Guidance. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either by phone call or computer audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. This webinar is being recorded and all participants are placed on mute for quality assurance. You will have the opportunity to submit text questions to today's presenters by typing your questions into the question pane of the control panel. You may send in your questions at any time, and we will collect these and address them during the Q&A sessions throughout and at the end of today's presentation. And with that said, I would now like to turn it over to Kathy Glazer.
Thank you, Val. And Angela, let's move to the next slide. Welcome, everybody. So glad you're able to join us today. We have a full and enthusiastic group and an action-packed briefing for you today. We're so appreciative to a handful of folks who have dedicated their time and information so that we can all learn more about the Phase 2 guidance for childcare, as well as how childcare providers and parents are navigating this time with provision of services and making of decisions about accessing childcare. You see the agenda here. First, we're going to hear from Dr. Emily Godbout, who will give us up-to-date information about what we do know about the virus and about the spread, and provide some great information for us to just feel equipped with as much information as we can about these health issues. Next, we'll hear from Jenna Conway and Tara Ragland, who will share information from this date on the guidance that's coming out from the Department of Social Services about Phase 2 for childcare providers. Next, we'll hear from a community-based provider, Taryn McCoy, who will provide some information about how she has been able to successfully navigate this environment and to be able to continue to operate and to do so with great service to those families who are able to tap into her care. We'll next hear from a home-based provider, Maria DeGregory, who will be able to share perspective from that viewpoint. And then finally, we'll hear from Tony Addison, who is a parent who has recently moved through a process of making decisions about putting her child back into care, and will provide her perspective on that. We'll also have plenty of time for Q&A throughout and toward the end. And just again, grateful for the opportunity to be able to share this information. Next, I'll hand it on over to Emily, to Dr. Godbout, and Angela, ask you to forward so that she can start her presentation. Thanks, Emily.
Thanks, everyone. Thank you so much for inviting me to speak today and on this platform. So I am a pediatric infectious disease physician at the Children's Hospital of Richmond, and I'm also part of the infection prevention department, and I've received some training in epidemiology. But I'm also a mom of two. I have a 3-year-old and an 18-month-old at home. So I figured, next slide, we could just discuss a little bit about the epidemiology and transmission of COVID-19 in kids, describe the clinical presentation in children, and then also review a couple optimal infection prevention strategies to make sure that we're keeping our kids and families safe. Next. Sometimes I look at these pictures and I wonder, how did we sort of get to this point? And I think that through all of this, one of the silver linings for me has been that for the most part, children have done really well throughout the COVID-19 pandemic. Next slide. This is a slide from the Virginia Department of Health. This is looking at the COVID-19 cases by age group. So if you look all the way to the left-hand side, you can see that children make up the smallest percentage of cases in the state of Virginia. And this is true across the entire country. Actually, in the U.S., children only make up 2% of all infections. Some people have theorized that maybe children aren't actually getting infected, but I think what's really happening is they probably are getting infected, but they have such mild symptoms or potentially no symptoms at all that they're really not presenting for testing. If we look at our testing data across Virginia and across the whole country, we see that children are much less likely to be tested. So I think that they're getting it, but they're doing so well that they're not presenting to care. Next slide. If we look at hospitalizations by age group, again, looking all the way to the left-hand side, we can see that children are much less likely to be hospitalized than adults for COVID-19. Slide. Nobody ever likes to talk about deaths, especially in children, but if we look at the data from in Virginia about deaths by age group, we can see that no one under the age of 19 has died from COVID-19 in the state of Virginia. Next slide. So overall, that data really just shows us that children are much less likely to be hospitalized and certainly aren't having some of those complications and death rates that we see in our older population. So moving forward, I think we should just spend a few minutes talking about how the virus spreads, because that helps us know how we can prevent transmission of the virus. Next. So the main mode of transmission, and it's the most important, is via respiratory droplets from person to person. These are really big, heavy droplets that can come out of your mouth or your nose when you sneeze or you cough. Generally, they are very heavy and they fall to the ground within sort of a 3 to 6 feet radius. And that's why we see all this information about socially distancing at least 6 feet. That's where that sort of comes from. These droplets are really large. They do not linger in the air, and it's not thought to be an airborne virus. None of our data suggests or points to that. For the most part, we can transmit respiratory droplets when we sneezing or coughing, and there's been some data to suggest talking, but we really believe that that would sort of be in very close contact with another person talking for a prolonged period of time. Really, this virus resembles the spread of the flu virus. Next slide. There's been a lot of talk about this virus being transmitted on surfaces, which, for daycares is really important because our kids touch a lot of things. Surfaces can be also called fomites. So there has been research to suggest that the virus can be found on various surfaces for differing periods of time. For example, on copper 4 hours, cardboard 24 hours, plastic, stainless steel 72 hours. Even though we can detect the RNA of the virus, it doesn't actually mean that that virus can still cause an infection. We don't think that transmission from surfaces or fomites is the main mode of transmission. We really believe it's the respiratory droplets, but we do respect that there could be potential for transmission, and that's why washing hands and cleaning high-touch surfaces is so very important. That is actually a picture. This is my one claim to fame. Back in the day, I did work in Dr. Anthony Fauci's lab when he was a director at the National Institute of Health. So that is him and I down there, but that's my only claim to fame. I know no one else famous. Next slide. There's definitely been some concern about the virus being in stool. Some studies have shown that you can detect the virus in the stool longer than you can detect it in respiratory samples. So for us as providers for children, we worry, right, about changing diapers, wiping our children's thumbs after they use the bathroom. But the good news is we don't think that stool is a major source of transmission. We really think that stool poses really minimal, if any, risk. And we believe that if there's any risk at all, it can really be prevented by good hand hygiene, which means washing your hands. Next slide. So you might be wondering, what symptoms do kids typically have? You can go to next slide again. So a majority of children present with very mild illness. And it looks a lot similar to other respiratory illnesses and childhood diseases. They may just have symptoms of the common cold or an upper respiratory infection. And these may include things such as fever, cough, runny nose, nasal congestion, sore throat. Sometimes a small percentage of children can have some nausea, upset stomach, vomiting, and diarrhea. And some children may have no symptoms at all. Various cohort studies that have been done looking at populations of children have found that sometimes 15 up to 30% of children within that cohort may have absolutely no symptoms at all. Next slide. We can see more severe symptoms in children, but it is rare. The children that we worry about And we always worry about with any respiratory illness are children that are less than 1 year of age, just because they may not have a completely mature immune system. And then we worry about children with certain serious underlying conditions that they may be at higher risk of severe disease. In the literature thus far, we've seen more severe infections in very medically complex children. These are children that are already potentially need ventilatory support, like they have a trach, for example, to help them breathe. So these are children that do have complex medical histories. Next slide. And then I'm sure a lot of you have heard in the news about the multi-system inflammatory syndrome in children. I know that's been a very scary thing for providers and for parents as well. This appears to be a little bit of a separate process from a direct infection due to the virus. This seems to occur about 3 to 4 weeks after the initial infection, and it seems to be a post-infectious response. And it's the patient's or host's body's immune system response to the virus. So there's probably a lot of factors at play here. And essentially what can occur is this sort of high persistent fevers along with systemic inflammation, lots of inflammation in the body. This can be very serious, but children that have been diagnosed with this condition have gotten better with medical care. Thus far in the state of Virginia, this is a week old, but thus far in the state of Virginia, there have been 2 cases of this identified in Northern Virginia. Although this is very, very scary and we've seen a lot of it in the news, we still believe that this is very rare. Next slide. So a lot of people, are considering sending their kids back to school or daycare, or have already gone back into daycare. And childcare provides really crucial support, as you guys all know, for parents and guardians that are returning to work. But a lot of parents may have some anxiety about bringing their children back into childcare programs, especially while COVID-19 exists in the community. But no matter the level of transmission in a community, every child care program really just needs to have a great plan in place to help protect children, but also their own staff as well, and help prevent the spread of COVID-19. Next slide. This is a toolkit that was posted on the CDC. This is just some guidance to determine if your child care program is ready to be open. And so it's interesting to kind of go through here and see everything that they're looking for to help kind of plan if you're ready to reopen. And next slide just summarizes a couple major things that we would be looking for. So first of all, opening really needs to be consistent with whatever the local and the state laws are. Not everyone is in phase 2. I believe Richmond is still in phase 1 in Virginia. But the basics for reopening with making sure that there's a process for screening children and employees as they're coming in, and that screening might look different at different places, whether that's a symptom check or an actual temperature check. Really promoting hand hygiene, making sure everybody can wash their hands and it's accessible. Masking for employees if they're able to, making sure there's a really good cleaning schedule, which I know everybody already has a cleaning schedule, but we might need to sort of intensify that, and then potentially even remove some things from the environment that are difficult to clean. And then encouraging social distancing is very important. Obviously, this is really difficult with very young children and babies, but to sort of help them socially distance, we could do things like increased spacing, having smaller groups, and then limited mixing of the groups, and then adjusting activities to really limit sharing of toys, supplies, and equipment. Next. And then just to reiterate why we are wearing cloth masks, they may help spread the virus and help people who may have the virus and do not know that they are transmitting it to others. So when you wear a mask, it's really to help prevent transmission, potentially from yourself to another person. And the CDC does not recommend any masks under the age of 2. I will say that it is difficult for young children to wear a mask. I think in the state of Virginia, it's required if you're 10 or over. And so, with my young children, my 3-year-old, I can't get her to wear a mask. And so we really just emphasize all those other infection prevention strategies like washing our hands, cleaning high-touch surfaces, etc. And next. So just a couple take-home points. Most children infected with COVID-19 have no symptoms or very mild symptoms. Children are much less likely to be hospitalized and less likely to have complications in comparison to adults. We can see severe disease and we can see severe complications like that multisystem inflammatory syndrome, but we do believe that these things are all rare. And good infection prevention strategies are key. Next slide. We have some great resources available on the Children's Hospital of Richmond website blog, including a 7-page coloring book that you guys can download and use in your daycare centers or use with your own children. And then just my own sort of 2 cents is that my husband is an ER physician, and then I'm, a pediatric infectious disease physician. So when COVID-19 first came, we didn't have the option of staying home or trying to work from home, and so we decided to keep our children in daycare setting, and they've been in daycare throughout this whole time period. Of course, the daycare has made lots of changes to make sure they're optimizing infection prevention strategies, but our kids have been super happy and super healthy throughout that process. Of course, we were nervous at first, but things have gone really well. And that's all I have for you guys. Thank you.
Thank you so much, Dr. Godbout. We do have a couple of questions that I'd love to go ahead and pitch your way before we move on to our next speakers. And one is really about, there's a kind of repeated question about, hearing about sort of risk for children. What do we know, or what can we consider when we think about the danger of children transmitting the virus to their caregivers who may be in that older or compromised health stage?
So, I think we know that children can certainly be infected with the virus. And so children do have the ability to transmit the virus. And so, if you are older or if you're immunocompromised, these are just some things to sort of keep in mind when you are interacting, with young children. But with good infection prevention strategies, that can hopefully help mitigate transmission. The problem is with really young children, right? They put a lot of things in their mouths. They're not always washing their hands. So they do have the potential to transmit. We are still learning more and more every day. There's some data out there that suggests that children can certainly be infectious, meaning they can transmit the virus, but it might be a shorter time period than adults. And so again, we're still sort of learning and sorting some of these things out. But I think that the basic answer is yes, they can transmit the virus, even if they're not having any symptoms. And we just need to be really careful around immunocompromised or elderly populations.
Thank you for that. And another related question, if children don't show symptoms, how helpful is screening if there aren't any obvious symptoms?
I think that the screening is still important just to pick up on some of those obvious symptoms. And I also think, because these are probably the parents that are going to be answering these questions, they might think that their child has no symptoms, but then if they're sort of being asked, has your child had X, Y, or Z, it might sort of trigger and say, oh yeah, actually they have been coughing or they have had this. So I think it is good to get in practice for screening, although you guys are right, you certainly would not pick up if someone is not having any symptoms.
Thank you. And one more question before we turn it over to Jenna and Tara. We have a number of questions about the wearing of face masks or face shields. And one member said, my staff have shared concerns that mask wearing has a negative psychological impact on the children, along with limiting their emotional development. Do you have good feedback that can be shared with staff on why mask wearing is beneficial?
Yeah, I think, the whole purpose of wearing the mask is to really help prevent transmission and keep everyone around you safe and healthy. I will say that I shared some of those same fears with my own children because their daycare center started universally masking. And really, within like a few days, my kids were completely comfortable with it. They're very resilient, and it's sort of part of the norm for them now. Our daycare center, they made really fun, bright masks, all different colors. They used superheroes, princesses, etc. So the kids actually ended up getting excited to see what types of masks their providers were wearing. I think if you're in an outdoor setting, you don't have to necessarily wear a mask. But I understand that there are certainly a lot of challenges with it, with wearing a mask. But I would say that kids are pretty resilient, and if you make it fun and make it not scary, I think that you'll be surprised how willing they are to accept that.
Thank you so much. And I'll say one more question that's come forward. I won't ask you to answer it because I think that's asking a lot, but I think it's important to put it out there that some folks are asking this question. If the data is still incomplete and with all of the unknowns, lack of treatment available, no vaccine, is it not irresponsible to continue to place our children and others at risk? I think that's a really thorny question and something I think that we probably all need to grapple with and think about what is the, how do we kind of weigh calculated risk with the benefit that comes from that. So I'm going to thank you again, Dr. Godbout, for your presentation, and I understand you'll be able to stick around for a while in case other questions come up for you.
Thank you.
Thank you. We'll turn our attention to Jenna Conway, Chief School Readiness Officer, and Tara Ragland, who is the Director of the Division of Licensing Programs at the Department of Social Services. And welcome to both of you. We'll look forward to hearing from you about the latest at the state level and also more detail about Phase 2 guidance. Jenna, we'll turn it to you.
As Kathy has said before, getting the information is incredibly useful right now in a world where there's 24/7 news media. Sometimes it can be hard just to get information, but that information is power. Tara and I are excited to be here. We appreciate everybody giving some time on a very probably busy afternoon coming from centers and homes, but we wanted to provide another update on where we are as a state in the response to COVID-19, specifically as it relates to the early childhood sector, and then also walk through some of the key points around the Phase 2 guidance. So go to the next slide, Angela. What I want to do, and just from the kind of the goal of sharing information with folks, give you an update on the current situation so you have the state landscape or picture at your fingertips, and then walk you through a set of key updates. I think talking a bit about childcare capacity as Virginia reopens, naming the key changes in the Phase 2 guidance, speaking a little bit more detail about group size, as that's one of the major changes in this next phase of guidance. Talk a little bit more from the state perspective on facial coverings. It was helpful to hear the questions already from the audience about that, and then where we go from here in terms of Phase 3 and additional CARES Act funding. Next slide, please. So you've seen a version of this slide, hopefully multiple times if you've been able to attend some of these webinars, but just want to keep tracking for you how we're doing as a state. Big picture, all of our schools remain closed for the most part with a handful of variances there, and most of our Head Starts are closed. You should expect tomorrow the governor will be putting out some statewide guidance on school reopening that we think will start to get some kind of pick up the energy and the momentum around each community across our Commonwealth, really making some hard and fast plans for getting schools back open. As of the end of last week, we've inched upwards in terms of the number of child cares opened and sort of reduced slightly the number of centers closed. We're just around 60% of our child care centers are closed and our religious exempt preschool. So again, those larger spaces that serve more kids. We're down to only 20% of our family day homes are closed, so down from kind of a peak of 25%. And so really the vast majority of our family day homes are open and operating. And what we're hearing from them anecdotally is that kind of more kids are coming back as the kind of economy continues to reopen. 2,500 programs roughly are closed. We're down. You'll remember at one point our peak was about 210,000 slots, kind of lost across the state. We're down to just under 195,000. And I think this has even popped up from Friday to 418 to 430. So over 400 programs are open. As I indicated in that little example, we're still not seeing kind of thousands of programs come online each day. It sort of tends to be in a slow but incremental coming back. 10 here, 15 here, 20 there. But again, this has been a solid trend for the last 3 weeks as we've been monitoring the sector. We've worked very closely with the governor, with our partners across the state to make it clear that childcare no longer has to be for essential personnel open. Childcare is allowed to be open for all working families across the state. Also still recognizing that our childcare educators are essential and kind of a priority, but really trying to support programs that want to open to be open and families that are looking to return to care. Those are our 2 priorities right now. First priority right now is making sure that there's enough childcare as all types of personnel return to work. We know this is kind of very incremental, kind of community by community, and looking at how we can continue to use the federal CARES Act funding that is specifically dedicated to childcare to support the field. Over 2,000 programs have been approved for the CARES grant. That's that new direct cash assistance. And if there's questions about that, my colleague Tara can take them in a little bit, but really trying to make sure that we can get cash to programs because we know it's an incredibly difficult operating environment. And lastly, you've heard me say this before, but just to note, we know that the kind of financial losses experienced over the course of the last, I think we're now up to 13 weeks, far exceeds the new federal funding available. And so I know as this thing goes on, folks have to make really tough decisions about furloughing employees, putting employees on unemployment, sort of scrimping and sort of saving to make payroll and keep the lights on. And so just an important acknowledgement of what a difficult context, all of these numbers occur in. And we hear that. And again, just express our deep appreciation for everybody's effort on the phone. Angela, if you move to the next slide. So one of the key things we've done, and you've heard us talk a little bit about this, is, the $1 million question out there beyond the one just asked about, how do we determine the right level of risk as we're bringing kids and families back, is how do we know if we've got enough care, right? And this is a classic kind of chicken and the egg. Our childcare needs to be open if families want to return to work and sort of support their self-sufficiency. On the other hand, as you all know, childcare can't be self-sufficient if they don't have enough kids in their classrooms to make the economics work, right? And so we're trying to support both of those things moving forward in a way where, that keeps it sort of safe for everybody. So in partnership with Childcare Aware Virginia, we continue to maintain a map that kind of tracks who's open, who's closed, and that both at the community level, a mayor, a board of supervisors, an employer can use this map to kind of get an understanding of how they're doing, where there's capacity and where there might be concerns. And so just an important reminder that this is out there. It's also really important that if you are coming back online, even if it's on a small scale, is that you're letting Childcare Aware know, you're updating your profile, and that you are letting licensing know. So we want to make sure as we bring people back online, or we bring centers and family day homes back online, that we're capturing it here and we can understand, all right, where are places temporarily closed, where are they permanently closed, where are people open, and where might there even be kind of capacity. In our conversations with Childcare Aware, we still hear that there is quite a bit of capacity within the system. It looks different community by community, but there's not any area of the state right now where they're saying we've got a lot more parents calling or, going online and asking for care, and there's not enough available. Now, we realize that that's only part of the story. We know that, parents, have slots. We know that as folks are coming back on and limiting group size, right, that there are all of these complicated kind of individual circumstances. But big picture, we are tracking this closely. We need your help in letting us know if you are coming back online, if you are increasing capacity. Let Childcare Aware Virginia know, let licensing know, and we are going to continue to closely monitor this, as Virginia reopens. Next slide, please. So now let's talk a little bit about moving into phase 2. So as of last Friday, the governor moved all of the state, with the exception of Northern Virginia and Richmond City, into phase 2. And so last week, we put out guidance from the Department of Social Services in partnership with the Governor's Office and the Department of Education for childcare and day camps in preparation for phase 2. We did, in order to revise this guidance, we worked very closely with the Virginia Department of Health. They've been kind of core at every step in the process, primarily to answer that question that was asked earlier about, how do we make sure we're doing this thoughtfully and carefully. They will be candid that there is we can never guarantee no risk. On the other hand, ultimately the health and safety of young Virginians, as well as of the families they live in and the communities that they exist within, are protected, right? So it's about really trying to kind of mitigate, is the term they use, but reduce the risk to a more reasonable level. We don't want to treat any kids or families as guinea pigs. And we know, as the doctor just talked about, that there are ways to do this that are safer. There are ways to do this that can keep most kids safe. And we're sort of slowly and carefully, trying to put those in place so that we can protect kids, protect families, and protect your staff. We conducted 3 listening sessions with over 100 stakeholders, public health experts, child advocates, a whole range of individuals, and that helped us in partnership with the Department of Health physicians and health experts come up with the phase 2 guidance. Most of it remains the same. And so when we talk about some of the things, health and hygiene, physical distancing or social distancing, disinfection, those best practices that you've heard us talk about before that are covered in the guidance from social services, most of that remains the same, largely because we took all of that from the CDC or the Federal Center for Disease Control, and there haven't been a lot of changes there. There are 3 key changes, and in the handout that's in this presentation today, there's a letter, and then there's the updated guidelines. The letter highlights the 3 key changes, and we'll kind of give you just a big picture of that, and then have Tara go into those. But we've got group size in terms of more flexibility there, some more flexibility on using pools for exercise and instruction. And then we heard loud and clear from our stakeholders that they want to be able to get kids outdoors much. And we know that there's a far lower risk of transmission. It's great for kids to get fresh air. It's summer, and so wanted to kind of emphasize some additional flexibility there. With that, I will turn it over to Tara. She'll talk a little about group size.
Okay, folks. Can you hear me?
Yes, we can.
Okay, so I'm trying to use 2 different machines here, so thanks for your patience. So as we go into phase 2 and discuss group size, obviously we've adjusted the group size to enable our providers, to serve children responsibly and address the developmental needs of children and protect children, families, and staff. Group size limit increases to 12, including staff, for children under 4 years old, provided age-based adult-child ratios are followed. For children age 4 and above, including school-age children up to age 13, group size maximum is 22, including staff, as long as social distancing of 6 feet apart is maintained. Age-based adult-child ratios must be followed. Groups of children may share the same physical space, classrooms and gymnasiums, as long as social distancing of 6 feet can be maintained and children do not mix between groups. Groups of children can play outside at the same time if social distancing of 6 feet apart is maintained and children do not mix groups. Maintain an overall limit of 50 people for outdoor activities and recess. Next slide. Are we on back to the original backup one? So Jenna, you covering the face masks, or you want me to do that?
I can cover it a little bit, and then I think you can talk more, Tara, about what folks are doing. So we have checked and double-checked, and we know that this kind of came up in response to phase 1. I know that the doctors have got some questions about this. And then in between the guidance that came out on phase 1 from social services and phase 2, the governor issued Executive Order 63. And so Tara and I thought it might be helpful just to put a quick chart up here that walks through where facial coverings are required and where they're recommended, and then just to emphasize the doctor's point about who should not wear facial coverings, because I know that sometimes it's hard to kind of discern, sort of in what situation do I do what. So the Executive Order 63 is, Governor's Executive Order. That's a requirement. And what it says is, who must wear facial coverings. It basically says, the executive order does not apply to kids in child care. It does not apply to child care or family day home employees. So again, Executive Order 63 does not apply to kids and does not apply to child care employees or family day home employees. What it does mean in terms of the kind of the broader otherwise served set of businesses is that your family members, right? So not the kids who are in care, not the teachers, not the employees, but your family members, if they are entering child care and camp facilities, need to be wearing facial coverings. It also would include any other sort of non-employees or non-kids, right, in the center. So if there are any other visitors, although, as per our other guidance, we're strongly discouraging outside visitors. But again, executive order, the governor's executive order, which really establishes the only requirements here, sort of limits it to those kind of two audiences: family members who are entering and other visitors. It does not apply to kids. It does not apply to kids in care. It does not apply to staff who should wear facial coverings. And again, this is the state guidance that recommends the use of facial coverings. So this is, again, not a requirement. It's not related to the executive order. This is just general CDC and state guidance on when it's recommended. It's really encouraging all staff and children over the age of 2, when feasible, when in a setting, as the doctor described, where you might be inside and when you're unable to maintain social distancing of at least 6 feet, right? So if you've got all the kids together inside, that is a situation where you should think about having folks wear facial coverings. Some programs, as we've heard earlier and we've heard before, might do it across always inside, even if they are 6 feet apart. But again, this is there's a flexibility here, and the kind of where we are saying you should seriously consider it is when you're inside and you're unable to maintain social distancing of at least 6 feet. Who may wear facial coverings, and again, this is not necessarily recommended, but places where we've heard that programs are wearing this, staff and children sometimes are saying they prefer to wear them all day, which just keeps it simpler rather than trying to kind of on and off and sort of the whole, like, are we 6 feet or not? So that's fine. If you wanted to wear it outside, you can also wear it if you are 6 feet apart, but you've said it's because you're being superheroes or because it's actually easier to kind of, rather than have the kids have to do the mental math around when am I wearing it, when am I not, it might be easier to wear it all day. And so that's fine. So if you as a program wanted to require that, or if families desired that, right, they just felt safer if kids were wearing masks more frequently, that's fine. Again, we're not saying, the state's not saying you have to do that, but we wanted just to make sure that we have heard from programs that desire that. And then lastly, who should not wear facial covering? So again, for children 2 and under, they should not do that. It could be dangerous for them. So they're strongly discouraging that. Again, not wearing masks while sleeping. Just sort of trying to make sure that kids are far apart. And then anybody who has trouble breathing or is incapacitated or otherwise unable to remove the cover without assistance. So again, just paying kind of attention if you've got, kids who have circumstances that are older, but they, might have respiratory concerns or issues, you should use your judgment and they should not be required to wear masks, even if they are inside. So We know this is complicated. We have heard that this is the area or one of the areas where there is a lot of variation in practice. Want to be clear that there is no requirement for the kids in your care or for your staff as it relates to the governor's executive order. And so again, that's just family members and outside visitors. We are strongly encouraging you to think about wearing facial coverings if you've got, kind of a situation where it makes sense. You've got older kids, they're inside and kind of in more close proximity to each other. But as the doctor noted, if you can keep kids apart and you can keep groups apart, there might be less need for masks. And everybody, if you need to, either to sort of to demonstrate to families that, that your sort of safety to kind of, to get kids to think more intentional about touching their face and washing their hands. If you decide you want to as a program, have more wearing of masks, that's allowable as long as you're not including kids who are under 2, you're not putting them on sleeping kids, and you're not putting them on folks who might have trouble breathing. So just trying to kind of get a little bit more clarity there, although ultimately, as you see, there is, by design, a bit of discretion there. And our public health experts really felt that was important in terms of the variety of contexts that we know childcare is offered in across the Commonwealth. Tara, anything would you add, or should I sort of shift to phase 3 and then we can take questions?
I think we can shift to phase 3.
Great. So the last thing, just before we open up for questions, we know, and we had heard sort of 2 things from the field last time in our listening sessions. I think the first of which is, understanding what's coming in terms of the next phase of guidance is very helpful, right? And so as Tara and I talked last week, the second that the ink dried on phase 2, we've already begun thinking about phase 3 and really making sure that we're hearing from stakeholders, sort of similar to what we did with the listening sessions last time on what's going on for folks, what are the operational kind of pressures, where are the opportunities, where are the challenges, where are the fiscal challenges. We are deeply engaging the Virginia Department of Health at every step in the process to keep kids, families, and providers safe. That is our top priority. And we are also kind of looking right now on the CARES Act funds, how we can use all of the $70 million to directly support the field during this crisis. So, we don't know exactly when phase 3 will be here. That will depend on the medical data. That is how the decisions are made, but we are already beginning to prepare, and across our task force and various listening sessions, trying to get out and hear from people. We've also tried to make sure that our guidance is in alignment with guidance coming out for K-12, for schools, and so we're not saying that we're kind of treating one age group differently across different contexts, but that, as you'll see in some of the guidance that will come out tomorrow, trying to align those to the greatest extent possible. So with that, Kathy, that's the highlight. Again, the document is in sort of in a handout for the presentation. Let's turn it over, Kathy, and see what questions we have.
Thanks so much, Jenna and Tara, as always, for lots of great information. We do have a good number of questions coming in. I think first I'm going to try to pick some that are specific to this new phase 2 guidance. And a couple are around the use of sprinklers. Is that permissible if they're not sort of community splash pad, but contained within a community-based program? Is the use of sprinklers allowed? Jenna or Tara, able to answer that question?
Tara, do you want to take that one, or do
you'd like?
Okay.
Yeah, I mean, as a matter of fact, Sharon and I were talking about that a little bit today. I think, that's something I think that we can probably be a little relaxed on. I mean, I think we would be a little less comfortable with, like a slip and slide or something like that. But I think with a sprinkler, you can run through and you can social distance appropriately. I think you just have to make sure that you're, keeping that social distancing and just, making sure that you're, that you have some appropriate fail-safes in place with the sprinklers. Jenna, are you kind of, because you and I haven't talked really much about the sprinkler issue, but I think I would be, okay with that.
Yeah, I think our understanding from the health experts was really the concern about social distancing and just kids being on top of some of those, like if you think, imagine like the sort of splash pad and kids in close proximity. I don't think that there's anything otherwise concerning about it. So if you think of it sort of more of as an outdoor activity that involves water, right, rather than like a splash pad, and you maintain the social distancing, I think it's fine.
Gotcha. And I think in looking at some of these other questions, I really appreciate that folks are trying to figure out what's required and what's best practice so that they know kind of where they have flexibility to try to make the best decisions for their programs. So I put this question in that category. Are children's parents required to wear masks at drop-off and pickup?
So, I mean, I'm going to answer this sort of what we understand from the kind of the general legal guidance here, and then encourage folks if there's an issue, they can always talk with their own, attorneys and have them look at the executive order. The executive order is pretty clear that patrons going in and out of kind of businesses are required to wear this. There's a child care exception that seems to be very clearly pertain to kids and to employees. So those are very clearly exempt. Parents are in a gray space where I think our attorneys have suggested to us that it could be interpreted that they're required to do it. So if you want to be extra careful, I would basically say to your parents, you need to do this. But again, you've also, everybody's kind of been, is going to their attorneys and talking about their understanding of the executive order.
Okay. Is the 6-foot distancing an executive order or best practice? I think this is similar.
That's best practice. Yeah, that's the best practice. Yeah.
Okay.
Yeah.
Thank you.
And I'll note on that, Kathy, and I'll channel Tara. I mean, I think, as Tara has noted before with the licensing team, like we get that, that kids are kids, right? And so, you could imagine a kid running outside of their square. You can imagine a kid, falling on another kid during the sprinkler play. I mean, those things happen. I think there's sort of two things that we're striving for. I think first of which is really, kind of arming people with the information to try to keep kids as safe as possible and keep their staff as safe as possible over the course of the day. I think the other piece of it, and we've heard this, is that the single biggest refrain I heard from providers over the course of the last 3 weeks is that signaling to parents and having parents trust that you're taking these steps to kind of keep kids safe is really important. And so again, we're not looking to do deficiencies for 6 feet, but I think being really thoughtful about, how do we kind of bake this into our day? What are the little cues? We had folks with shelves, we've had folks use hula hoops, right? We've done, kind of group identities with like t-shirts or things, right? Like we're the red group doesn't mix with the blue group. Like all of those things I think are both keep kids and families and our staff safer and send a really important message. And I think in this critical stage, as we are gradually reopening, reassuring our families, reassuring your staff kind of day in, day out that we're committed to safety is really important. And so it's less about deficiencies when it comes to 6 feet and more around, kind of getting in this habit around the new normal that can help keep us all safer.
Mm-hmm. Thank you. And again, just reading through so many more of the questions, I think providers are grappling with when there's ambiguity, and it feels like there's ambiguity when there's not a requirement. But I think that just hearing again from Dr. Godbout this morning and thinking about kind of the health implications, I think that gives providers the opportunity to use kind of the best practice of what is known to be the safest in terms of prevention of spreading the infection is probably the best thing to lean on. I'll just put that out there in case that's helpful to some of these folks who are asking questions. For example, one is the ambiguity of whether masks should be worn by staff leaves the door open for confusion and pushback by parents when versus when it's definitively mandated by the state. And again, I'm pressing you, Jenna and Tara, but I recognize that there are limits to how you can respond to that based on what's actually required by the DSS standards.
No, that's a very helpful question, and I can at least explain. I can't resolve the tension, Kathy, but I can explain the why. I mean, it gets very complicated once you get into the kind of employee-employer relationship, right? I think goes across a broad set of different contexts, right, for which the executive order relates to, as well as just the kind of the sort of federal legal status of individuals, there are kind of implications around unions and other things left over this space. But, I think that the attorneys advising the governor, were really clear that this couldn't be about mandating employees to wear it, right? It's much more focused on folks coming in and keeping employees safe than it is about a requirement for employees. And so we hear that. I don't think you're going to see the state step in, and sort of, and in that space between employer and employee, even though, I can reflect that back. But that is the kind of the spirit of that executive order is much more about the outsiders coming in, and the state is it's just a little bit trickier in terms of the state mandating something, between an employer and employee. Mm-hmm. I do think, for those of you who, I know that, there's been a couple other webinars with folks talking about sort of attorneys. If you have an attorney or an attorney and want to kind of talk through that with them, in terms of your risks and liability and all those things, feel free to do that. But I don't think you're going to see a requirement from the state on this.
Okay. That's helpful. Thank you, Jenna. And I think I'll ask a couple more questions that are coming through related to phase through guidance, and then a couple that we're seeing about the CARES grants that you all may want to answer. And then I think we'll move on to our next speaker, because I have a feeling she may address how she's navigating some of these areas of ambiguity, and then also hear from a parent, and then we can circle back to answering more questions if that works for you all. So the increased group size for playground of 50 people is not consistent with the next guidance that groups cannot be mixed. This was confusing and essentially means it has not changed from phase one. Is that correct?
So the focus here is that you don't want to get in trouble, in terms of the executive order and other things, and having somebody drive by and see a whole bunch of kind of kids and adults in a space, right? So it's more of a kind of reminder about that requirement sits in place, and that requirement of 50 also sits in place for, our kind of our K-12 system. In terms of the shift on the group size, particularly for the kids who are older, you're going to have a lot more folks out in that space, and I think that's been the kind of the bigger shift. The safer thing is to keep the groups separate to the greatest extent feasible, and so to some it's not as far as folks would like, but I think we, as it relates to both kind of keeping kids safe and contract treatment, we felt like this was sort of as flexible as it could be at this time.
Okay. When will DSS resume in-person licensing and subsidy inspection visits?
So we haven't really discussed when we're going to return. I mean, we actually have done some in-person visits, very, very few. It depends on the situation. Obviously, we've never completely said we were going to give up all face-to-face inspections. It would just depend on the circumstance. Obviously, we're still responsible for, health and safety inspections if there's some egregious issue that we have to look at. But in terms of something more routine and regular, I think we're going to probably wait a little bit and hear maybe more from what the governor would, have us do. And I think we're going to look at more of a a routine return, to normalcy with the regular working population. I think there's a lot of things we would have to do to make even our staff feel comfortable. I mean, we maintain licensing for not just child care, but for adult care as well. And so there's a lot of considerations we would have to take into account right now. So I think we're a little bit away from that. So you guys will definitely be made aware of when things will return to normal. But I think we're a little bit away from that at this point.
Thank you, Tara. And one more, maybe hard to answer question. When do you think phase 3 will go into effect?
So maybe Jenna can answer that a little bit more, but I think we're already starting to prepare for it because we don't want to be at the last minute trying to figure it out. Because I think that's going to be a little more difficult, so to speak. But Jenna, do you have any thoughts on that?
Yeah, I mean, it's sort of the general rule of thumb is between, sort of no less than 2 weeks. Potentially, between 4 and 6 weeks is potential. I think I would just be really hesitant to bank on anything, knowing that we don't know how this thing operates in the summer, right? We've never kind of come back before, and I think the part of the reason for using the data, which they look at each day at the Virginia Department of Health, rather than just setting a time date, is that you want to sort of see what's happening. Again, they're saying Virginia has not yet hit its peak, right? And so monitoring that very, very carefully. I do think that we are working on the guidance now. I think we'll continue to monitor the data carefully, and then I think you're going to see a lot more activity from school systems, following tomorrow's announcement. So I think you're going to start to see some more movement. And my guess would be, sometime, in July, or around about that time.
Thank you. And one more, I'm sure the question that you want to hear again, when should providers expect to receive the checks for the CARES grants?
Well, I knew I wasn't going to get away from that, so I was expecting it. I think, again, we have actually had checks go out. We've had some that have been issued. We continue to be frustrated with the process in terms of, I'm trying not to throw anybody under the bus because I understand it's very difficult. We have a Department of Accounts, and so there are just different processes that we have to go through that I think I've said this before. I just had no idea how difficult it was to get checks cut at the state level. So, I know it's frustrating for you guys. It's a difficult ask when you have money that you're waiting on. I don't know that there's been anybody that's really been declined. So, if you're not going to get something, you probably would have heard about it. But it's just one of those things that it's just taking a lot to process. I mean, our team, as far as licensing, everything's off our desk for the most part. So I think that's a good thing. We've processed over 2,000 and some. So, and they go through our finance department, then they, go to another group to kind of, get batch headers and all this kind of stuff done. And then, Department of Accounts is relatively slow in terms of how many they can process. And, there are some, folks at our finance level, we only had 2 or 3 folks that could process those, and it's a manual process. So I know that folks have received checks so far. So I know that's not really what you guys want to hear, and I get it. So, I just can't tell you how much we do appreciate your patience. And if I could write those checks myself, I would do that for you. However, I cannot. But they are coming. So that old adage, the check's in the mail, is probably more accurate now than it ever has been. So, just know that they are. And I think, as Jenna alluded to, I know we're, looking at some other options too as we move forward for, CARES funding and things like that. So, patience is not something that's easy at this point, but just hang in there. We are, working through this. So, coming.
Thank you, Tara. There's so many more questions for you all. I think what we'll do now is move to the next speaker and we will hear from her. And I think some of her information may resolve some of these questions. And if y'all can stay on the line, I'm sure we'll circle back and want to get through more of these questions with you. And as we're bringing up Karen McCoy, who is the owner and executive director of Small Steps Academy, I just want to reiterate again, I think this balance and nuance that we're hearing with so many of these questions of best practice and best judgment is really appreciated in an era when there are some things that are mandated and there are some things that are not going to be mandated, but we still want to all work toward the best and safest situations for our children and families and for the providers and staff within classrooms. So that's, I think, a difficult kind of a dynamic for all of us to try to balance. But let's sort of put that as our North Star and look forward to hearing from Taryn. So Taryn, I think we'll ask you to go ahead and give us your presentation.
Okay. Good afternoon, everyone. As Kathy stated, I'm Taryn McCoy, and I am Executive Director and owner of Small Steps, located in Southwest Virginia. I own 2 sites, one in Roanoke City and one in Salem City, and we serve children ages 6 weeks to 12 years. So today, I just want to speak on my personal experience with owning a child day center and being the Executive Director of a child day center and what we have experienced thus far during the pandemic. Prior to the pandemic, we have 150 children enrolled in both localities. So total 150 children. We are a state licensed site. We do provide transportation to children to and from home. We participate in Virginia Quality. We are a mixed delivery site. So we have lots of programs within our program. So once COVID happened, all those programs just went away in a sense. So we really had to restructure our entire site so that we could be able to care for all the children on a daily basis. So this is our 12th week in the COVID pandemic, and I am just going to speak on how we have done some things differently at Small Steps so that we can ensure that our children are safe. The first piece is just making the decision on being open. It was a very hard decision. I wasn't sure if we should or should not even be open. Would we be able to accommodate the children with the 10 or less rule? Do we have the space to accommodate being 6 feet apart from each other? There were so many questions that we had, and we had to answer them very quickly in a quickly turnaround time. So before I was willing to make that decision, because generally I make all decisions with weather, when we're going to close for weather, or I make decisions regarding when we will do a fire drill at our site. But for this piece, I wasn't really okay with making decisions solely by myself. So I entrusted in my staff and wanted to get their opinions and get their thoughts and to see if they were even willing to work during this time frame or to see if this was something that we would be able to do. First, we had an open dialect over the phone. We did our first Zoom call on a Saturday after schools were closed for 2 weeks to make the decision on whether or not we would be open. So our first decision was we would be closed for 3 days. And during that 3-day closure time frame, my biggest focus was for us to become educated, more educated on coronavirus, more educated on ways that we could make our site more efficient, ways that we could help stop spreading the disease within our childcare community, and just to ensure the parents that we are, one, trying to make the best decisions we can. So the first 3 days we were closed. Our staff was educated. We just asked as many questions as we could to local doctors and nurses, some of those being parents within our site, and some of our own children's pediatricians. They were all, as a community, willing to help us in so many different ways. So we were able to build up our knowledge and then make adjustments in our site. The biggest adjustment we had to make was one of our biggest adjustments when it first occurred was just not being able to be around each other. All of our classrooms have their own entrance and exit. So our children were entering and exiting from that classroom door. The families were entering and exiting from that classroom door. If they had a 2 and 3 and 4-year-old, they unfortunately had to go to 3 different doors. And that is not our common process. Our common process is to enter in one door in our facility, coming in and exiting. So we were very overwhelmed with that because the children like seeing each other, and our teaching staff were just not used to that. But a way we were able to get around that is our teaching staff, we just put telephones and an intercom system in everyone's classroom so that they could have that communication with each other and still feel a part of the childcare community. Our next piece was just taking temperatures every day. I'm sure everyone is experiencing this. We weren't sure how we were going to do it and how we were going to be as thorough with this process. And we did a COVID questionnaire too as well for the families. We communicated this to the families ahead of time, and they all are in full support of us participating in this. It's done at the door, at the entry level, and then the staff procedures are completed prior to them entering into their classroom. So an admin staff will conduct for the staff members, and then the staff members are required to conduct these screenings for the parents and the children. We don't allow any parents to come in the building. They unfortunately have to stand at the door and give their goodbyes and their waves, which is not always pleasant at drop-off or pickup. So that has been an adjustment too for us. I think our next biggest barrier when COVID first hit was just the panic. We were just panicking. We just didn't know what to do, when to do it. Would we be able to accommodate the 10 or less? It's just, we were in a state of shock. Like I had referenced a fire drill. We know when we're going to conduct a fire drill. The staff doesn't know, but they know when they hear that fire drill alarm, they know what to do because they've been trained in it. Well, COVID, we really didn't have a way to train our staff in that prior to. So that piece, I think the panic was very scary for us. However, with every panic, we've been able to face every barrier and move forward, and we've really seen a brighter side. The next piece is the next phase that we went into. So the next piece was getting the doors open and being available for the families, which we've done very well. We are constantly changing our strides and changing our methods. One method we just changed last week was just the temperatures. Instead of having a thermometer that's pressed on the forehead, we've gone to all wireless and touchless thermometers because they are quicker on time frames, and they just make things a little bit easier for us when children are arriving, especially when we have families that need to get to the door, drop off, and go on. So we just made that adjustment. So I think daily, weekly, we are making accommodations and we're changing things every day. The next piece I would get into is funding streams. So our biggest piece was who's going to pay for childcare, who wasn't going to pay for childcare. For my site, the biggest piece was finding that having multiple funding streams has been so beneficial. Not just having solely subsidy families or solely private families, just having a good array and a good mix of different funding streams has really been very beneficial for our site. It has just allowed us to stay open, and it's allowed us to stay afloat, which I'm just so appreciative that we can keep our doors open with all these new requirements, especially with the staffing piece, and just having more quantity usage. So we wanted to make sure that our funding streams were very solid, and so far we have not experienced a huge decline in our private clientele, of course, because those families are home, but we've been able to stay afloat with the staff we have and the income that we have coming in. So that was a big piece for us because we were just so very scared. The last piece is where we are now. We are in a process where we're running smoothly. We're definitely changing things every day. So I do feel that every day we have to change something. But the biggest piece that I have too, along with where we are now, is just keeping items in the center. For us, it's been hard to get supplies, but we've tried a few strategies that have really worked for us as a center. We've asked our parent community, so the families that are home every day, if you run out or you're doing an online order for Amazon, would you be willing to donate any of these items? Sent it out in the email to families, and things were just being delivered. We couldn't believe how many families were willing to donate to our little center, our little community. United Way has been an excellent instrumental piece to making sure we have those funds available, not the funds, but the items readily in our site as we need them. We just make a phone call, and they have an awesome team that has been delivering items to us. There has been a lack in food as well as cleaning supplies. So we've also traded items with other centers. I had lots and lots and lots of snacks here in our site because we do our purchasing of food items early in the year for the entire year. So we go 2-3 months at a time. So we were able to trade items with another site. So it's really been helpful for us to build in that childcare community. So that has been very, very helpful as well. Lastly, I think that any site who is willing to stay open or wanting to stay open during the pandemic, I would heavily state rely on your colleagues and try to build a community within your community, because I didn't know Small Steps had a huge community within our center and our parents until I asked, and we received all the support that we needed. So for us, we've just been able to build a community within a community, and we've been able to hit these strides very successfully. Some of these barriers have been difficult and complicated, but for the most part, once we got into routine, it's become a part of our new norm. And I encourage everyone who owns a site, if you're able, to try to give it a try.
Taryn, thank you so much. Such terrific information. I see a couple of questions that have come forward for you. I'm going to ask you a couple now, and then we're going to shift to make sure that we can hear from Tony Addison, our parent representative, and then probably circle back and ask you a few more questions. First of all, would you be willing to share the questionnaire, the COVID questionnaire you sent to parents?
Yes.
Folks are just wondering what kind of questions. I think it would be really useful, and if we can ask you to share that with us, we'll make sure and share back out to participants if that's okay with you.
I sure will. It is a checklist. It's a daily checklist, and we send it to parents, and we sent it out to parents prior to our opening, and each day the teacher will do a checklist check off, and I will gladly send it to you so that you guys can forward it in the email.
Thank you so much. And one more question related to parents. How did you do your parent training on safety protocols that you have in place?
We did 2 separate trainings. So we did one via telephone because we had a lot of families that can call in. But then I had some families who could not call in at all. So we had to send out literature in an email. And it was a very lengthy email, which is one reason we wanted to do over the phone, but we could not tap into every family at the same time. So we just wanted to make sure that we had 2 methods readily available over the phone and email so that they would have some literature to review or to hear from us as well.
Awesome. And one last question for you at the moment, Taryn. Any practical ideas for social distancing of toddlers and preschoolers?
Yes, I'll tell you a few we've tried. We have tried group identities. That works out really well for our school-age children, where we have T-shirts on site. We do have a washing machine and dryer, so we're able to wash them on site, but we do give children a specific color, and then we just transition throughout the day. We've also marked off spaces in our preschool classrooms, but in our toddler rooms, that is the classroom we've experienced the hardest time keeping the distancing because the 2-year-olds are really struggling with that. Our preschool students, at first, it was very alarming for them because they could not stay in that one place that we wanted them to. It was totally against anything we've ever taught in preschool. So we really had to be inventive with that, with limiting the amount of items they can share. We also have allowed the children to bring items from home. We do a cleaning check with them, and we allow them to bring them in so that way they can have their toys with them throughout the day. So that has helped as well.
Thank you so much, Taryn. So helpful to hear these practical suggestions. I know folks appreciate it. I think for now, we're going to give Tony Addison, our parent panelist, a heads up that we're going to move right to her and hear her thoughts before we go back to answering more questions. Tony, can you unmute and join and share your thoughts?
Hello?
Yes, we can hear you, Tony. Thank you. Can you hear me?
Okay, I just want to make sure my audio wasn't on my iPad as well, or my laptop as well.
Got
So,
you.
it has feedback. But yes, where would you like me to begin?
We had
Okay,
asked you to address a few questions, and if you don't mind just sharing how you made your decisions and what you might suggest to other parents in the same space.
Well, I have I guess an unusual situation where I work from home and I can, if I, my child can stay home with me. So I personally only take her to daycare about 3 days a week, if sometimes not even that. But the reason I decided my daycare never closed. She goes to Russian Board Daycare in Emporia, Virginia. When the COVID-19 started, a lot of kids, of course, stopped coming. So they pretty much only dwindled down to maybe like 2 or 3 teachers. And they probably have a total of like 15 students. And that's probably about the same now, probably about 20. Yeah, they're still doing most of the same practices that you are doing with your daycare. One parent, they have a little area where you can step inside the building, but that's pretty much it. You can step inside the building, but you stay there, and your child, they take your child's temperature. That's where you check them in and everything, and they wash their hands. And once that parent is finished, they leave, and then they let another parent in. So they've been doing basically the same precautions as you. They haven't really said anything to us about face masks. But as far as why I decided to let my child keep going, I had stopped letting her go, honestly, for the first 3 weeks because I was not at my house. My apartment was getting renovated. So I was, commuting from North Carolina every day. So that had a lot to do with it. But eventually what made me take her back was for my own sanity. I am a single mother, and she's with me 24/7, and it's just me. I don't have anyone else, so it's just me and her at home all the time. So, and she's 2. She's 2 years old. So, you get to a point where you get it helped both of us for her to be able to go to daycare 2 to 3 days a week. And I could get as much work as I can get done at home. And, so I was trying to just not, keep her home and everything. And it was just better for both of us for her to go back. She's happier. I'm happier. So I think that's very important as far as keeping them healthy. Because I already struggled with what to do with her at home all the time, But other than that, so as of right now, like I said, I am only letting her go 3 to 4 days a week because I feel like I don't want her to go more than she has to go. As for everybody's sake. And I am on I have subsidy from DSS, so I constantly want to make sure I keep using it and everything. So that's pretty much it. That's pretty much, Did you have any specific questions?
Tony,
Hello?
thank you.
Oh.
Yeah, we hear you. That's okay. We hear you, and we hear your daughter too. And so really appreciate your sharing the information. I think it's just helpful for all of us and for providers to kind of understand what parents are thinking and how they're approaching the decisions about coming back to care. Do you have thoughts that, for the childcare providers who are on the line today about the things that have been most helpful to you that your provider has done to help you make you feel comfortable about bringing your child back to childcare?
Honestly, I think the biggest thing they have done is pretty much keeping me informed. they make sure they're keeping us emailed, and we really have an update pretty much from them every couple of days. So that was my biggest thing. I never had to be worried about, oh my God, what's going to happen now? When is the daycare going to open? This and this and this. They literally had it already like a plan. I mean, of course, nobody planned for this, and there was definitely, obstacles. Like for instance, we now have to start bringing her lunch to. I have to bring her food to daycare because they don't have, they can't afford to feed all the kids anymore. So that was a big thing for us, because food gets expensive. So but I can't complain. Like I said, I'm just happy they're open because so many places aren't, and so many kids and parents, are stuck at home. So that me having to bring their lunch really was not a big deal at all. But like I said, and we're my child doesn't get sick. I thank God. We've been very, very lucky. I haven't had a child who has been in and out of the hospital, and I'm constantly feeling as the same. So our immune system, maybe I'm constantly feel like we might have already had it, but you never know. I feel like all the kids might have already had it. So we are still taking precaution, but we just haven't had any symptoms. I haven't known anybody with any symptoms. So we've kind of really been quarantined here.
Yeah, that's super helpful. Tony, thank you so much.
Yeah, we stay home.
Yeah, that's great. I think we'll ask a couple more questions for our other speakers, but if you can stay on, you may want to put yourself on mute, but we may circle back and ask you for some more perspective, and just really appreciate your sharing that today.
You're welcome. I'll be here.
Okay, terrific. Thank you. And Taryn, I think we have a couple more questions for you. Folks have wondered if you've had any, since you've remained open, have you had any situations where you've had a case of COVID show up, within your center, either staff or children or families within care, and how have you managed that?
I have not, luckily, experienced any children, parents, or staff enrolled or affiliate of our site come in contact with COVID. We have sent children home with the symptoms, thinking that just taking precaution and just wanting to make sure that the center was safe, but we have not, thank you, Lord, had any experiences with COVID.
Great. Well, let's keep it that way. And I'll ask either Taryn or if Jenna or Tara have information about where can providers purchase touchless thermometers.
I purchased them on Amazon, and they also have them locally in your local drugstores, CVS, Walgreens. We did do a trial run with them first with just 3 or 4, and I had purchased them locally, but because I needed such a large quantity for the amount of classrooms, I did go ahead and order them online via Amazon.
Thank you. Let's see, we have other questions about hoping to understand more about, could there be a possibility of reverting to phase 1? What do we know now about phase 3 so that providers can begin to prepare? Sarah, Jenna, any response about what folks should know or think about in terms of what the guidance will be potentially shifting, either reverting to phase 1 or moving forward to phase 3?
So kind of a couple of thoughts. I mean, I think some things are likely to remain the same in the new normal, right? I mean, I think that it will, the kind of checking and doing some kind of screening, I think will sort of, whether you use temperature or use symptoms, I think will continue to be important. I think, as discussed by the doctor, right, social distancing seems to be here for a while, right, in terms of that is one of the best ways to protect kids and families and staff, right? And so, as well as more frequent hand washing, additional kind of cleaning, frequently touched items that might go in mouths, right, that and then have kind of droplets on them. So those things which have remained true for phase 0 phase 1, and phase 2 will likely remain the same. I think we are looking at the water activities piece very closely. I know that's been there's a lot of pressure across not only day camps and childcare, but with our kind of all of our municipal pools and our kind of private pools, right? Folks would like to use water for recreation, right, beyond exercise purposes. And I think we'll continue to look, at the kind of the group size, because we know that has such an economic impact, particularly for the younger kids. On the other hand, I think as we feel more and more confident that sort of social distancing, is the safest thing, you get harder and harder to kind of, go bigger groups, knowing that, there's just not a lot of social distancing possible with, 1-year-olds and 2-year-olds and 3-year-olds, right? And so I've heard it often described as kind of, well, this is the family, right? In my infant classroom, it's the family. And so, we don't really socially distance, but we also then keep the group very small. And I wish there was an easier way. The two biggest challenges we hear from folks, right, is one, we wish there were more hard and fast rules. And unfortunately, that there are best practices, right? And those are often kind of trade-offs with each other. And we wish that there were just a way to kind of get back to normal. And, I think, maybe once everything is safe and we're on the other side of this, right, we'll just wash our hands more. But, we don't expect there to be, you can't have a bunch of hugs. You can't have kids on top of each all day long, right? I mean, we can't, mix the groups and have, sort of 60 kids all sort of playing together, whether that's a sort of an event or whatever else. So that's just dangerous right now. And so, we think there will be another set of changes in phase 3, but I think some of the things will likely remain the same, and the social distancing and trying to keep the groups smaller and as much as possible separate from each other will likely, be our new normal for a while, Kathy.
Thank you, Jenna. And I see that we have already raced through an hour and a half and probably need to close, although we have many more questions and I think many more opportunities for all of our speakers to share insights with folks who have asked these questions. I guess I'll just, close with saying once more, I think it's just, this is, again, something that we are day by day trying to figure out how to move through with holding as constant as we can and balancing these really conflicting and sometimes confusing priorities of safety for children, safety for providers, safety for the teachers and the staff on site, for parents who are bringing their children to the site, for parents who are balancing need for getting their children back to childcare so they can go to work with their fears and concerns about the safety of it. Similarly, I hear that our state leaders really trying to make sure that they are balancing, making it feasible for small businesses like childcare to get back to operations and to operating in as feasible and economical as well as safe way possible, and also putting out guidance that provides for meeting the different mandates, but also striving to balance the best practice. I see everybody on these webinars and the folks who've asked questions really trying to do the most diligent and the most prudent thing in terms of weighing all of this. And it's just a moment that we're all kind of living into together. I think that some of the questions that have been raised today by some of our participants, and we had fully, 500 folks on the line today. We'll share out this information, share the recording to others who want to be part of this conversation. I think there's some ideas that have come forward that I'll pursue with Jenna, with Tara, with Taryn, with Tony, with others who've been able, with Dr. Godbout, who've been able to be part of this conversation to see if we can make sure that there are tools, guidance, and tip sheets and opportunities for the conversation to continue. So just want to thank everybody again, all of our speakers, Tony, Taryn, Emily, Jenna, Tara. Thanks to the VECF team for driving these webinars, and to all of our participants who are showing up and being part of these conversations. We're committed to continuing them. None of this is simple. There are no easy answers, but appreciate that with everybody's help, I think we'll be able to get to some manageable solutions to make safe childcare possible for our families and young children and for the providers. Thanks everybody for your time today, and we will follow up and appreciate everybody's participation. Thanks so much.